Physicians Kay Miller Temple and David Schmitz discuss the Targeted Rural Health Education Project and the importance of using plain language to share health information in rural communities. The program engages medical residents in writing relevant, community-driven health articles for publication in rural newspapers.
Right out of residency, I landed in a little logging town, St. Mary's, Idaho. As a rural family physician, our local CEO of the Critical Access Hospital said, "You're brand new, it's time to get the community to know you. So why don't you write an article in the newspaper?" And that, believe it or not, was kind of intimidating. As it turned out, I never did write that article. Instead, I joined the softball team, which I was equally poor at. But what I learned in my time in Idaho is that we had resident physicians who were doing a lot of their more urban and intense training in Boise. But it was really different when they got to the rural community because they needed to engage that community and see what the health needs were.
You ended up bringing the Targeted Rural Health Education Project to North Dakota. When you got there, what were you hoping to accomplish as a medical educator?
One of the things I wanted our physicians to learn was not to go to a community and tell them what to do, but to be partners, to be engaged. And I can tell you, showing up as a 29-year-old, newly minted rural family physician, the community teaches you.
After medical students are caring for patients in the clinic, they start to notice the information gaps that our rural citizens have because it's hard to get access to health information in rural communities where we don't have internet. So rural newspapers are so strategic to getting health information out. One article written in one small paper can really influence many, many rural citizens.
In rural Idaho, the residents wanted to write about the issue of suicide and suicide prevention. And the editor had said, "We were happy to publish this because we know it's leading to dinner table talks that maybe wouldn't have easily happened in a household." So that conversation at the dinner table becomes part of that conversation, perhaps in the doctor's office. The students are really engaged in this too. They feel like it's actually made them adapt the way they talk to patients, even in the exam room, about other health issues.
We recently talked about the phrase quality of life. Do you ever hear your attendings say, "Does that knee pain affect your quality of life?" That's medical jargon. What the patient will understand more is if you say, "So how many steps does that knee pain allow you to walk every day?"
I can remember one of the articles was, "What do you do with your knee pain and how do you continue regular exercise when it's snowing and 20 degrees below zero outside?" Those kind of things to communicate about how to get safe exercise within your home during the winter months can really make a difference, but they also show I care and I understand the community you live in, and the patient can tell you, you get it.
There's power in small ends, and speaking in plain language is so beneficial to being able to deliver good care.
Produced by StoryCorps Studios in partnership with the Centers for Medicare and Medicaid Services Office of Minority Health. Interviews recorded by StoryCorps, a national nonprofit whose mission is to illuminate the humanity and possibility in us all, one story at a time.